Genomenon is a genomic intelligence company, and we specialize in human genetics. Our unique capability is to understand the complexity of genetic language. We developed our AI and algorithms to normalize all that genetic content. And from there, we're able to create a genomic associations capabilities. So we understand how genes and variants associate with diseases, phenotypes, and other key concepts in genetics like functional consequence or genetic mechanism to develop therapies and understanding of genetic diseases such as rare diseases, more common diseases like cardiovascular disease, and ultimately cancer. If I were to think of Genomenon and NashBio as individual puzzles, we both have pieces missing. And I think we complement each other by having that piece. The Nashville bio data will have real-world evidence data from real patients. This is where you're going to find the de novo variants, which means it's a novel variant that's never been published. And so you have to assess, what does that variant mean? Well, that's where our data comes in, because our data is predicated on the published evidence and the empirical evidence. And so we may have a variant that was published at the same protein domain or in the same residue, and therefore that we can provide data that will complement that data to understand the role of that de novo variant in disease. And I think together we have a big picture. You know, it's widely known that drug programs with genetic information or biomarkers have a higher success rate of becoming a drug. And therefore, the data set that NashBio is producing and our data together give a more complete understanding of the genetics of the disease of interest, which then will drive more successful clinical trials because you've got the right patients enrolled and a better understanding of the mechanism of disease that'll marry up with the mechanism of the drug. We worked with a company called Loxo Oncology. It's in the public domain. We've done presentations with them where they were interested in activating variants in RET. The RET is the gene, RET, in the context of thyroid cancer. When we first met with them, they had 32 variants that they were interested in. We uncovered about 130 variants of the right type, meaning gain-of-function variants in RET in the context of that disease. We also showed them that 8 of the original 32 had counterfactual evidence of being gain-of-function. They were certainly pathogenic, but they weren't gain-of-function, which meant that we were able to help reduce risk of that trial by eliminating those variants from the label. I think the other big thing that's going to come out of all of this is diagnosing patients before there's an issue. You know, let's identify patients at risk because of their genetics, and then do the appropriate things to make sure that they'd never develop the disease, whether that be an appropriate diet and exercise program because you're at risk for cardiovascular disease, or if you have a rare disease, getting you diagnosed early and off a diagnostic odyssey so you get treatment right away. If you think about breast cancer 15 years ago, it was one disease. Now it's 150 diseases? I think that's going to be true with all the genetic diseases. That means more specialized treatments to have better outcomes for patients.